I recommend that all eligible people in the United States get vaccinated for COVID-19. That is going to dramatically decrease your risk of getting infected with SARS-CoV-2, the virus that causes COVID-19, and also dramatically decrease the risk that even if you were infected, you could transmit it to others. And that's because we still have a considerable number of people in the United States who are not vaccinated yet, and people are in close proximity for a longer period of time. If they're traveling within the United States and the person is vaccinated, there's no need to be tested, there's no need to quarantine. The only thing everybody should do is to continue to monitor for symptoms. Now, if somebody's traveling from outside the United States, they're going to need to do a SARS-CoV-2 test at least 72 hours before they board the airplane and come back to the United States. But as long as they do that and it's negative, then there should be no further quarantining that's required. So if you have children who are unvaccinated, that is probably not the time to bring them to very, very congregated areas with lots of people, because we know they're still at risk of getting infected if other people in that area are unvaccinated and able to transmit the virus. Even if you have your children doing fastidious masking, there's still a risk. So if you have unvaccinated children, I think it's still safe to fly, but of course they will always be masked. And if you go to places that are more outdoors, more open space, and you're not congregated with lots of other people, I think it's very safe. You just have to think through the steps of what's going to happen on the vacation and position things so that you're not putting your unvaccinated children at risk. And we still do have people getting sick from SARS-CoV-2. We still have people being hospitalized, and unfortunately we still have people who are dying as well. So we're not completely done with this. We still have to be careful.